Have you ever sat in the bathroom feeling absolutely certain that you need to have a bowel movement, yet nothing happens? Maybe you've spent 20, 30, or even 45 minutes waiting and hoping for relief. You feel pressure. You feel uncomfortable. You know your body is trying to tell you something. Yet despite your efforts, nothing seems to move. Eventually, you give up. You stand up frustrated and tell yourself you'll try again later. Then later comes, and the exact same thing happens. If this sounds familiar, I want you to pay very close attention to today's discussion. What many people dismiss as just constipation can sometimes become a much more serious problem, especially for adults over the age of 60. Today we're going to talk about what happens when stool becomes stuck in the rectum, why it occurs more frequently as we get older, what warning signs you should never ignore, and what steps may help you respond appropriately. Most importantly, we'll discuss when it's time to seek professional medical care. Before we begin, I'd like to ask you a simple question. Have you ever experienced a period where you felt unable to completely empty your bowels? If so, leave a comment below and tell us your age. Many people deal with digestive concerns quietly and never talk about them, but you might be surprised how common these experiences are. Now let's start by understanding what may actually be happening inside the body. Imagine a river that has flowed smoothly for decades. The water moves steadily. Everything functions as expected. Then, little by little, branches, leaves, and debris begin collecting in one narrow section. The river doesn't stop immediately. Instead, the flow gradually slows. More debris accumulates. The opening becomes narrower. Eventually, the water struggles to pass through at all. In some ways, this is similar to what can happen inside the digestive tract. The large intestine is responsible for moving waste through the body while also absorbing water. Under normal circumstances, this process works remarkably well. Material moves forward. Water is absorbed. The stool remains soft enough to pass comfortably. However, as we age, several important changes can influence this process. The muscles of the digestive tract may become less active than they once were. Physical activity levels sometimes decrease. Many people drink less water than they realize. And certain medications can contribute to slower bowel movements. When these factors occur together, stool may remain in the colon for a longer period of time. The longer it stays there, the more water is removed from it. Over time, the stool may become increasingly dry, firm, and difficult to pass. In some situations, it can collect in the lower part of the digestive tract and create a blockage that becomes difficult to clear naturally. This condition is sometimes referred to as fecal impaction. Many people are unfamiliar with the term, but understanding it is important. The symptoms can be confusing. Some individuals notice persistent pressure in the lower abdomen. Others feel as though they constantly need to use the bathroom, but are unable to fully empty their bowels. Some experience discomfort while sitting. Others report feeling bloated, unusually full, or generally unwell. And here's something that surprises many people. The problem doesn't always appear suddenly. Often, it develops gradually over several days. At first, you may simply notice that your bowel habits have changed. Then the intervals between bowel movements become longer. The discomfort increases. Eventually, the situation becomes difficult to ignore. One of the biggest misconceptions is that this is simply an inconvenience. In reality, when waste remains trapped for extended periods, it can place stress on surrounding tissues and create additional complications that deserve attention. This is one reason healthcare professionals encourage older adults to pay close attention to changes in bowel habits rather than assuming everything will resolve on its own. Another important point involves hydration. Many adults over 60 do not experience thirst as strongly as they did when they were younger. As a result, it's possible to consume less fluid than the body needs without realizing it. Even mild dehydration can contribute to harder stools and slower movement through the digestive tract. Medication can also play a significant role. Certain prescription medications are known to affect bowel regularity. This does not mean anyone should stop taking prescribed medication on their own. It simply means that digestive changes should be discussed with a healthcare professional if they become persistent. Now let's talk about something many people find surprising. In some cases, a person may believe they are experiencing diarrhea when the underlying situation is actually much more complicated. Liquid stool can sometimes move around a blockage and exit the body, while the larger mass remains in place. Because of this, symptoms can occasionally be misleading. This is one reason why self-diagnosis can be difficult and why persistent symptoms deserve careful attention. If you're finding this information useful so far, take a moment to support the video. Our goal is to share practical information that helps adults better understand the changes that can occur as we age. In the next section, we're going to discuss why adults over 65 face a higher risk of developing these issues, which everyday habits may increase that risk, and what warning signs should prompt immediate attention. Why do these problems become so much more common after the age of 65? This is a question I hear frequently, and the answer is important because understanding the causes is often the first step toward prevention. Many people assume that constipation and bowel difficulties are simply an unavoidable part of aging. While certain changes do occur naturally over time, there are usually several contributing factors working together behind the scenes. Let's begin with movement. The digestive system responds remarkably well to physical activity. You don't need to run marathons or spend hours in a gym to benefit. Something as simple as regular walking helps stimulate normal digestive function. Every step creates gentle movement throughout the abdomen and encourages the intestines to continue doing their job. However, many adults experience circumstances that reduce mobility. Arthritis, joint pain, surgeries, balance concerns, injuries, or chronic conditions may lead to spending more time sitting and less time moving. When activity decreases, digestive movement often slows as well. Another major factor is nutrition. As people get older, appetite sometimes changes. Meals may become smaller, certain foods may be avoided. Some individuals begin eating less fiber than they did earlier in life without realizing it. Fiber plays an important role because it helps create softer, bulkier stool that moves through the digestive tract more comfortably. Without enough fiber, bowel movements can become less predictable and more difficult to pass. Fluid intake deserves special attention as well. Many older adults tell me they simply don't feel thirsty very often. Others intentionally drink less because they want to avoid frequent trips to the bathroom. Unfortunately, the digestive system depends heavily on adequate hydration. When the body lacks sufficient fluids, stool naturally becomes drier and harder. Then there are medications. This is an area that often surprises people. Numerous commonly prescribed medications can affect bowel function. Pain medications, iron supplements, calcium supplements, certain blood pressure medications, some allergy medications, and various other prescriptions may contribute to constipation. For someone taking several medications at the same time, the combined effect can become significant. This doesn't mean the medications are inappropriate. It simply means that bowel health should become part of the conversation during regular medical appointments. There is another factor that rarely gets discussed. Many people ignore the urge to have a bowel movement. Perhaps they're busy, perhaps they're traveling, perhaps they're uncomfortable using public restrooms. Over time, repeatedly delaying bowel movements may make it harder for the body to maintain a regular rhythm. The signals become easier to ignore. The stool remains in the colon longer, more water is removed, and the cycle gradually becomes more difficult to break. Now let's talk about warning signs. What symptoms suggest that a situation may be becoming more serious? The first warning sign is persistent difficulty passing stool despite repeated attempts. The second is ongoing pressure in the rectal area that does not improve. The third is abdominal discomfort that continues for several days. Some people also notice a feeling of fullness even when they haven't eaten very much. Others report decreased appetite because they simply feel uncomfortable. In some situations, there may be nausea. There may also be unusual fatigue. When symptoms continue to build rather than improve, it becomes increasingly important to seek medical advice. One mistake many people make is assuming that more straining will solve the problem. In reality, excessive straining may create additional discomfort and can sometimes lead to other issues. The body is often telling you that force is not the solution. Patience and the right approach are usually far more effective. So what should someone do if they suspect they are dealing with a significant blockage? The first recommendation is simple: stay calm. Anxiety often makes the experience feel even worse. Take a moment to slow down, breathe normally, and think systematically rather than reacting out of frustration. Next, focus on hydration. While drinking water alone may not immediately solve an established problem, adequate fluid intake supports normal digestive function and helps prevent further drying of stool. Gentle movement may also help. A short walk around the house or neighborhood can sometimes stimulate natural intestinal activity. The key word here is gentle. This is not the time for intense exercise or aggressive efforts. If symptoms persist, many people discuss over-the-counter options with their pharmacist or healthcare provider. Products such as stool softeners, osmotic agents, or other medically appropriate treatments may be considered depending on the situation. However, it's important not to randomly combine multiple products without guidance. Different treatments work in different ways, and the most appropriate choice depends on the individual circumstances. One of the most important lessons I want to share is this: there is a difference between temporary constipation and a situation that requires professional evaluation. If symptoms become severe, continue for an extended period, or are accompanied by concerning signs such as significant pain, inability to pass stool, inability to pass gas, vomiting, or other unusual symptoms, medical attention should not be delayed. Healthcare professionals have tools available that can help determine exactly what is happening. Sometimes imaging studies are used to assess the situation. Other times, treatment can be provided directly. The important thing is not to suffer in silence. Too many people wait far longer than they should because they feel embarrassed discussing bowel health. But digestive health is health. There is no reason to feel ashamed about seeking help. In fact, asking for help early often prevents much larger problems later. Before we continue, I'd like to ask you another question. How many glasses of water do you typically drink each day? Leave your answer in the comments below. You might be surprised by how many people discover they are drinking much less fluid than they originally thought. In the next section, we're going to talk about recovery, prevention, daily habits that support healthy bowel function, and practical strategies that many adults over 60 can incorporate into their routine. Now let's focus on the part that matters most in the long run: prevention. Because while knowing how to respond to a digestive problem is important, creating habits that help reduce the chances of facing the same situation again is even more valuable. Many people spend years searching for a miracle solution, a special supplement, a particular tea, a quick fix that promises immediate results. But in reality, digestive health is usually built through simple habits, repeated consistently over time. Let's begin with the foundation. Hydration. If there is one habit that supports healthy bowel function more than almost any other, it is maintaining adequate fluid intake. Water helps keep stool softer and easier to pass. Without enough fluid, the digestive tract must work much harder. For many older adults, drinking enough water requires intention. You may not feel thirsty. You may become busy and forget. You may simply prefer other beverages. That's why creating a routine can be so helpful. Some people keep a water bottle nearby throughout the day. Others drink a glass of water with every meal. The method matters less than the consistency. Small habits performed daily often produce the greatest results. The second pillar is movement. Our bodies were designed to move. You do not need an intense fitness routine to support digestion. In fact, some of the most effective activities are also the simplest. A daily walk, light stretching, gardening, gentle swimming, even household activities can contribute. The goal is regular movement rather than perfection. Many adults notice that their digestive system functions more predictably during periods when they stay active. Movement encourages rhythm, and rhythm is one of the digestive system's best friends. The third pillar involves food choices. When people hear the word fiber, they often imagine complicated diets or dramatic lifestyle changes. Fortunately, that isn't necessary. Many fiber-rich foods are already familiar and enjoyable. Oatmeal, beans, lentils, apples, pears, vegetables, whole grains. These foods can help support healthy digestion when included regularly as part of a balanced eating pattern. The key is gradual change. Increasing fiber too quickly may lead to temporary bloating or discomfort. Slow and steady adjustments are usually much easier for the body to tolerate. The fourth pillar may be the most overlooked: routine. The digestive system appreciates consistency. Eating meals at approximately the same times each day can help create predictable digestive patterns. Many people also benefit from establishing a regular bathroom routine. For example, some adults find it helpful to sit quietly in the bathroom for a few minutes after breakfast. There is no need to strain, no need to rush. The goal is simply to allow the body an opportunity to follow its natural rhythm. Over time, this routine may help reinforce healthy habits. I also want to discuss something many people ask about: laxatives. These products certainly have a role in certain situations, particularly when recommended by a healthcare professional. However, relying on stimulant laxatives too frequently may not be the best long-term strategy for everyone. This is why discussing recurring constipation with a healthcare provider is so important. The goal should always be to identify and address underlying factors whenever possible. Now I'd like to share a story. Several years ago, I spoke with a gentleman in his 70s who had struggled with irregular bowel habits for a long time. He believed it was simply part of getting older. For years, he ignored the problem. He adjusted his plans around it. He accepted discomfort as normal. Eventually, after discussing the issue with his doctor and making a series of surprisingly simple changes, he noticed a dramatic improvement in his quality of life. He increased his daily walking. He became more intentional about hydration. He improved the consistency of his meals. And perhaps, most importantly, he stopped ignoring symptoms when they appeared. Several months later, he told me something that has stayed with me. He said, "I thought I was getting old. What I really needed was a better routine." That statement contains an important lesson. Aging certainly changes the body, but many challenges we associate with aging can be improved through awareness, healthy habits, and appropriate medical guidance. We should never assume discomfort is something we simply have to accept. Your digestive system is an important part of your overall health. It influences comfort, energy, appetite, daily activities, and quality of life. That's why paying attention to digestive changes matters, not because we want to focus on problems, but because we want to protect our well-being. If today's discussion has taught you anything, I hope it's this: listen to your body, notice changes, take symptoms seriously, and never feel embarrassed about seeking help when something doesn't feel right. The earlier a problem is addressed, the easier it often becomes to manage. Before we finish, I'd love to hear from you. How old are you? And what is the single most important habit you use to support your digestive health? Share your answer in the comments below. Your experience may help someone else who is facing similar challenges. And if you found today's video helpful, consider subscribing to the channel. Every week, we explore practical topics related to healthy aging, digestive wellness, daily habits, and ways to maintain independence and quality of life as the years go by. Thank you for spending this time with me. Take care of yourself, stay active, stay hydrated, and remember that small daily choices often have a bigger impact than we realize. I'll see you in the next video.